prescriptions definitely are readily available. Pain medications are prescribed frequently and in large quantities. Throw in a couple of refills for fun, and you've got a good supply. Again, the leftover medications, I do a thing called the brown bag days, where I actually have people go into your medicine cabinet, take everything out of your medicine cabinet, put it in a brown bag, and we actually give them the brown bag. And then they come in and we'll sit down with them, and we have pharmacy students and our pharmacy residents actually meet with them to go through to make sure that they're taking what they're supposed to be taking, and kind of see what else is in there. And people will bring in prescriptions that were written from in 1997, 2002. And for the most part, they just either they don't know what to do with them, or they just want to keep them because you just never know when I'm going to need them again. So the leftover medications, I'm going to speak to that a little bit about a DEA take-back day that's coming up that we can really help clean some of that stuff out. But 70% of the people who abuse prescription pain medications say that they got them from friends or family. Now, they don't say whether they got them by asking them or got them by stealing them, but they do get them from friends or family. This was in the Wall Street Journal last year. Actually, no, it was earlier this year, 2011. In 2010, there were over 1 million prescriptions written for oxycodone that were filled in the boroughs of New York City, the 5 boroughs of New York City. So I can't necessarily tell you where a prescription was written. So the prescription could have been written out of state, but I can tell you that it was filled in one of the 5 boroughs of New York City. And that is enough for 1 in 8 residents of the 5 boroughs, or 13% of the population. Okay? That's a lot of oxycodone. If we look at where the highest increase was, that would be Brooklyn. Okay. Now I drove through Brooklyn, I didn't have a problem. Staten Island, I don't know, getting out of it, I might need some help, but 116% increase in the Bronx, 95% increase in Queens, 98% increase in Staten Island, and 120% in Brooklyn. Okay, and so this is a significant increase in the number of prescriptions just for one drug. Okay, we haven't even talked about our benzodiazepines. We haven't talked about any of the other narcotics that we're seeing being written. So the number, this is where these drugs are coming from. The prescriptions are being written. Okay, and again, this doesn't really include the oxycodone highway that we saw from Florida into Kentucky and back up into the metropolitan New York area, where there were literally oxycodone mills where there were pharmacies, and the only drug that they carried was oxycodone. That was the only drug that they had in the pharmacy, and they were filling prescriptions. People were leaving, leaving their state, driving to either Kentucky or Florida, having these prescriptions filled, and then going back home. And so we've actually shut some of those down. A number of pharmacies in Florida and Kentucky have been shut down by the DEA. And what you're seeing now is some of the things, the unfortunate events that we're seeing in retail pharmacies now, that retail pharmacies are being held up at a rate higher than liquor stores. And that is a result of the frustration of a supply chain being cut down very, very significantly and very, very quickly. So it's causing people to actually act slightly, very desperately, and so they're going to where the only place that they can think of where they're going to be able to get the drugs, and that's a pharmacy. The pharmacy is not being held up for money. They're not being held up for testosterone and some androgen containing medications, which it used to be years ago. They're being held up specifically for oxycodone. The National Forensic Laboratory Information System is actually a system whereby if you ever have to do a drug test for work or for any kind of reporting mechanism, these are usually the people who do it, and they're actually looking at the number of positive tests for either analgesics or benzodiazepines that they're finding in their sampling, broken up by section of the country. In the Northeast, the number 1 drug in the Northeast and across, actually makes them number 1 across the country, is oxycodone. So there's a very significant difference in the Northeast between oxycodone and the number 2 drug, which is hydrocodone, but you actually see much closer usage in the other areas of the country. But in the Northeast, oxycodone remains our number 1 drug. For benzodiazepines, we see alprazolam written across the country. That's our number 1 drug. The brand name there is Xanax. So that's just kind of, it's really surpassed all the other drugs. Number of reasons why, perhaps, I'm not really sure. So what drugs are being used? Actually, all drugs are being used, and actually some drugs that we didn't even know about. And again, this is before before being able to survey for things like the bath salts and the potpourri. But we see OxyContin and Ritalin, opiates, benzodiazepines, and any combination thereof. Again, easy access to medication. A number of places where you can get them. A very disturbing trend that I read about in one of my articles that I was prepping for is if you either have an open house, if you're selling your house, or if you go to an open house. If you're having an open house, this is one of the things that it's recommended that you do is you clean out your medicine cabinet and lock whatever in your medicine cabinet up, because people will actually, one of the things you're checking out when you're buying your house is you want to go see the bathroom.
Can I see the bathroom?
I mean, it's a reasonable request. And so they're going to the bathroom, and while they're checking out the jacuzzi tub and making sure you got a really good shower head, they're checking out what's in your medicine cabinet, and they're helping themselves. Okay, so again, the information is is the ammunition here, so I share what I can get. This is one of my favorite ads from Purdue Pharma, which actually said you're not your average drug dealer, but again, if you look at the people who are most likely to have prescription medications in their possession, it's the elderly, and they're probably also the people who are less likely to say, gee, I'm running a little low on whatever that drug was, and I just must have forgotten, I must have lost them, I must have done something.
I have to actually, I can see another one, which is actually a doctor up there as well.
I would agree with you there.
And that's a huge problem, actually.
The most important tool that we have in preventing drug abuse is a doctor's pen.
So, this is cute, but there are doctors out there who are rogue doctors, just really unethical, criminal, who are writing tons of prescriptions and
Absolutely.
And with due respect, yesterday's paper, arrested 4 pharmacists out in Long Island.
Yeah,
they always do me proud. They always do me proud. Yeah. And my response, and just because it's my reflective action. My response to that was when I got that email was that I'm never going to be on the evening news telling people about my pharmacist who worked in my neonatal ICU unit who saved a baby's life because they gave the right dose of prostaglandin, or because they made sure that a hospice patient had good quality care at the end of their life. That's not sexy enough for the evening news.
That's the problem.
And for every one of those rogue pharmacists who I would love to have drowned at birth, I've got 250 that are doing the right thing. So it's frustrating.
And I think that goes for the doctors
as
well.
It absolutely does. You had
besides the logical answer to this, if the one drug is going up so much in the region, why isn't there a dialogue about a different delivery system? Why can't you regulate, that it's not available at the pharmacy, or it has to be targeted to the doctor, or new technology that's out there for connecting the patients to the medical care that, if they take 30 pills and, the blood test says that they really weren't taking it, it went elsewhere or something like that. I don't know.
Well, there's a couple things, and that's actually some excellent points all that you brought in there.